everybody. It is so good to have you here with me. Imagine
if you have your vision as the car with the right team.
Imagine how quick that vision will come into the footsteps. Something that was taking 5 years takes 3 months. This morning is all about the leadership and influence. There we go. Good morning, everybody. Such a great honor and privilege again to see you online. And thank you so much for joining with us on the Inside Show. What a great honor and privilege to have you with us here. Today's subject, teen mental health. Wow, you won't believe how many young people just put their hand to their life and they don't think anything of it. The stats showed in South Africa 23 people per day commit suicide, and worldwide after every 40 seconds somebody commits suicide. The numbers are high. I in the studio have our family pastor with us here. I also have Leandra, our producer, with me, and then with us will join Kim McKay, who is a physical psychologist. We are just so thankful for her to come online and to be with us and to give us some professional clinical advice how to work through this. But before we continue, I would love you please to subscribe. We need you in the zone. So every time when you want to know when we on, you hit that bell. When you hit that bell, you will get a notice every single time that we are on the Inside Show. Well, this morning we're going to show you a video clip. We're going to have our psychologist on the line, and there's good stories coming your line. There's an interesting story that Leandra just want to share with us around a movie that's playing. I don't know if it's still playing or if it's still available on Netflix, but I would love you just to share a little about that and what was the cause of that, and also the teenage suicide numbers and the difference between before the movie and after the movie and things like that. Well, Leandra, you don't need any introduction. The young and beautiful Leandra, our producer in the studio, she's going to just give us some information. And then when we're done with that, I want to show the video clip.
Yes.
And then when we're done with the video clip, there's another true story about something that happened here in Johannesburg. And this story is based on a true story about one person that wanted to commit suicide, and he turned his life around. Leandra, just give us some information there.
Okay, good morning, everybody. Thank you so much for tuning in. This is really an interesting topic, and it is a topic that we have to deal with so much empathy and with so much sensitivity, because we do know that there are people out there who do suffer from mental illness and depression and suicide, and this show is exactly for those people. So if you do know of anybody that needs to hear this, especially somebody who you feel like is really in a deep, dark spiral of depression and anxiety, please do share this with them. But I'm going to get into it, and I'm going to be speaking about the dangers of social media and mainstream media on our mental health. And so I'm going to be speaking specifically about 13 reasons why. And it's a series on Netflix, so it's a Netflix original. And it's a series on Netflix called 13 Reasons Why. It's a teen drama series. So it has already, it has 3 seasons, and I think it was cancelled before the 4th season, but there's already 3 seasons out. So the first season came out in 2017. And there was a huge, everybody was raving about it, and I'm sure some of you are familiar with 13 Reasons Why, because it's a very popular teen drama. And so what happened was there was heavy backlash towards the producers and towards Netflix for this series, because what people were saying is that this series glamorizes suicide. And I think the main trigger was the fact that there wasn't any trigger warnings, because sometimes you have to put a trigger warning in the beginning of a if something is sensitive for certain sensitive viewers, and there wasn't any trigger warnings before this. And in the end, the finale, they actually show a scene where the lead female character cuts herself with a blade, and there's blood all over the place, and she's screaming in agony. So this was so like graphic and so visual that they were saying that your main audience is teenagers who still need to develop that frontal cortex where our emotions and our things sit, and it's underdeveloped at this age. How can you show something so graphic? And they were saying that it glamorizes suicide, because the reason why they were saying that is because she leaves tapes behind for the people who she blames for a suicide, and they listen to the tapes and the story unfolds. That's basically the premise of it. But I'm just going to read some stats for you. And the reason why this was such an issue is because they were saying that that studies have found that dramatic images and graphic descriptions of suicides may contribute to the suicide contagion effect, which means that when you see it, what you feed your mind, you start then manifesting it in your behaviors, and you start planning around, how am I going to do it? There's different ways to do it, and young people are not that great with separating fiction from reality. And that's the reason why they involve themselves so much in these series. They see themselves as that they influenced by it in the way that they talk, in the way that they walk. Can you imagine then a young person who is maybe undiagnosed with depression and anxiety watching this, seeing what this girl is going through, identifying with her, and seeing that there's a solution, and the solution is to kill yourself. And that's the reason why this was such a pertinent issue. And then also internet searches, after people started watching the show, internet searches about suicide increased. That same year when that first season came out, suicide was also the second leading cause of death for people between the ages of 10 and 24. So the reason why 13 reasons why was associated with, and this number shocked me. I was completely like bewildered by this. 13 reasons why was associated with 28.9% increase in suicide rates among people in the United States, aged 10 to 17 in the month after the first episode aired. So literally a month later, this is when we got these stats.
So high.
And that's the reason why there was such heavy backlash, because parents could not understand what is this increase in suicide rates. And that's the reason why there was such a deep study into this.
Somebody the other day, when I asked for certain comments, I went live Sunday morning, and I asked people just to give me some ideas of what to do on the show.
Yes.
And somebody also mentioned music.
Wow.
And music also plays a huge role in suicide. Not just music alone, but what people see on television, as you mentioned. And it looks so easy just to put your hand to your own life and just chicken out of life.
Yes.
The purpose for the show here today is simply to give some hope there. To give some young people hope, not to give up on life. It's not worth it. Yes. You know what? I know so many people who did their matric twice, and today they've got master's degrees and doctorates, because there's certain things that just happen in their youth, and not that they first-handedly responsible for it. Things like a divorce, things like financial difficulties within the house, and there's so many contributory factors, and you think the best way is just to stop your life. But by the grace of God, I know you're going to make it. And this program is for somebody watching out there that's depressed, and you don't know how to turn your life around, but there is hope for you, and things will work out for the good. You don't have to grow weary. I would love at this point in time just to discuss one more thing around the WhatsApps. I was shocked this week. I was on a line with another preacher, and he counseled somebody somewhere in Johannesburg, a 70-year-old girl that wanted to commit suicide, and the parents called him in. I mean, just this past weekend, not years back, just past weekend. And I didn't know that there was a WhatsApp group where all these youngsters will come together, and they either call one another out, or they will give some advice how to commit suicide. Now, I asked the clinical psychologist yesterday online, how is it possible that we cannot break into that arena, because it's very controlled. It's only for them. They will not allow anyone in there. And now this is how she explained. She said, imagine a group of people that's alcoholics. and there's not one person guiding them out, what type of advice would that be?
Would they give?
Imagine a whole group of youngsters
Sure.
that's suicidal. It doesn't matter what it based on what. If it's bullying, if it's looks, if it's financial difficulties, if it's a divorce, it doesn't matter what it is. And there's nobody to guide them out. And the truth is, some of them go that far. Just to that specific night before the suicide, to go live, to
Yes.
say I'm going to commit suicide and this is my method I'm going to use. And you know what? The whole group protects them.
Yes.
They don't call the police. They don't call the parents. They don't come. They just allow them to do it. It shows you how toxic it is. But it's
Definitely.
darkness, the demon forces working to destroy our young people. But we are here to find multiple reasons to get out of this. I'm gonna show you a video clip. In short, we'll only play a minute of this video clip, and it was on the news. When was this, Leandra? About is it SABC 1 or 2 or 3?
So this was on Morning Live.
Yeah.
This was a video that was on Morning Live. It was the latest one that I could find was in 2018. I couldn't find anything earlier than that. 2019, sorry. I couldn't find anything later than that. So this was something that played on Morning Live, and it was during the Suicide Prevention Month, which is in September. It's the Worldwide Suicide Prevention Month. So it was just the month after it was aired in October. But the link of this video is in the description below, so we have put it there for you to go and reference it afterwards.
For anybody out watching there live, please do me a favor. Ask any questions. We're about to get the clinical psychologist online. Please ask any form of questions. We would love to ask Kim all necessary questions, but just watch this video with us. Thank you.
Children as young as 12 years old are now undergoing treatment and being admitted in psychiatric hospitals. A case in point is this Kimberley-based mental health patient who was diagnosed in her early teens.
Ik was op 15 jaar oud.
I was 15 years old when I was diagnosed with anxiety and depression. It changed my whole life. It was hard for me to learn, concentrate, or remember anything in school. It is a very difficult journey because no one understands. Even when you try to explain, they don't understand. So the journey with depression is very lonely, hard, and painful.
Baie seer.
The now 27-year-old says her comfort zone is around her mother, who is also living with depression.
Ek glo nie.
I don't think people have the patience to be around us because they don't see us as normal. They pull back from us, and that is where the loneliness comes in. You realize that you are different.
Is different.
The mother says their journey
I'm back. I hope you enjoy that video there. I'm so glad to have Kim online here with us. Thank you so much, Kim, for your kindness, and thank you so much for coming online. We really, really appreciate your presence here this morning. And before we get you online there, Kim, I just want Pastor Neil Hassenberg, who's our family pastor, just to relate a true story that really happened here about one guy that wanted to commit suicide.
Yeah, so I read the story about a year ago or so about this guy who had lost everything. He went through a terrible divorce. His wife had an affair. He lost everything. So the property that he lived on was an heirloom that was given from his father to them. And it's on a small holding in Mildersdrift. And so things really went bad. He lost his job. He was just at the place of despair. And on the day when the auctioneers were supposed to come in and take the house and auction the house off and the property, he decided that he's going to take his life on this day.
Sure.
So on the farm, there's a tree as you enter through, getting into the small holding. And for weeks he had planned how he's going to commit suicide. And he would put, a week before that, he'd put up the rope, and so he'd plan it in his mind. So when these guys come in, they will see what they have done to him. They brought him to nothing. He lost everything, and so he would then take his life. So on the morning of the auction, he was walking up to the tree, getting ready to commit suicide. And while he was there, he had one horse left. And the horse came up to him and stood right next to him. And he says that in his explanation, he looked into the horse's eye, and as though the horse was speaking back to him and said, "When you are gone, who is going to help me? Who's going to take care of me? I'll be left alone. And right there, he aborted the plan to take his own life. He went on to establish an equine therapy farm right on the borders of the Henops River near Hardebeespoort Dam. And so what he's doing now, he's using horses as a therapy for those who are depressed and who are suffering from anxiety.
That's a beautiful
Changed his whole
story.
life around.
That's a beautiful story. Thank you, Pastor Neil. Let's get to business. I am so
Yay.
excited to have this beautiful young lady online here, and we had an introduction meeting last night. I said to her, "Man, we gel so well. There's a chemistry with
Yes.
myself and you and her,
Yes.
and then she's really meant for television, eh?
Yeah,
she's just
definitely.
flowing." She's flowing so well, and I'm just so glad. Kim have a master's degree in clinical psychology, and she's practicing in Pretoria. Kim, please, let's start somewhere. Introduce yourself, and then let's Kim McKay. Introduce yourself. Tell us a little about your academic background and what you do and where you practice, and then we'll start with all the anxiety, depression, bipolar disorder, insomnia, and all this other stuff. That's of such great of a problem in South Africa, based on the 23 people dying per day. Well, Kim, just give us a little background about yourself.
Thank you. Good morning, everybody. As I've been introduced, I'm Kim McKay. I'm a clinical psychologist, and I've got my master's degree in clinical psychology. I also have a private practice in Pretoria. I've been in private practice now this is my 4th year in private practice. Yes, and I'm very passionate about psychology, about mental health, and I'm extremely excited to be part of this conversation, because I think we just don't have enough of these mental health conversations in all our communities, and I think in our country in general. So I'm really excited to be here and looking forward to this discussion with everybody.
Thank you so much, Kim. We've got so many people out there watching now, and one of our, as a matter of fact, our strategist phoned the health department and so many other people and school principals and so on, just to watch, because people don't know what to do with the high level of suicides. And just to start off, the increased factors of why young people commit suicide. Can you just share a little about that, Kim?
Well, there can be various reasons why teens are committing suicides. If we look at our country right now, there's many stresses that our young people are facing, and whatever stresses there are can really affect them in a negative way. So you have things like, for instance, not passing matrics. Matric, that's something that's really on the forefront right now as the results have just come out. So feeling as though they're no longer part of the group, they didn't pass just like everybody else, puts a lot of pressure on them and makes them feel unworthy. And that feeling of worthlessness can really be intensified if they don't have the correct coping skills to be able to deal with that. So things like yes, not passing matric, things like abusing alcohol and drugs puts them at increased risk of committing suicide. Relationship issues, family issues, different forms of abuse can also be sort of contributing factors as to why teens commit suicide. Bullying. I think the factors or the lists are endless. Anything that can sort of be a trigger or a stressor rather for a teen can really be something that can push them over the edge and make them feel as though they don't want to be alive anymore.
Yeah, I was thinking to ask you this question. How does it start? How's the build-up? How do they get to a deep form of depression?
Yes.
Because I can imagine there's a build-up to get to a deep form of depression. So you don't just arrive there. And that is now, even if it's teenagers or if it's parents, irrelevant or of your age, how do you arrive to that deep form of depression? And then when you're done with that, I will open the floor up for Leandra to ask your question, and then Pastor Neil as well.
Okay. So we all experience the blues. We all sort of feel sad sometimes. Something happens and it makes us feel down or sad. But it's temporary. It lasts a few days maybe. It doesn't continue for very long. With depression, it's those feelings amplified and over an extended period of time. So it's not just the blues. It affects the whole body. So it affects your thinking. It affects your physical being. It affects your mind. Everything about you changes when it comes to depression. So you can't just pull yourself together and say, okay, today I'm gonna get up and do something. There's a whole lot of things that are happening in the body. So it's a buildup of these blues that would happen, and then the environmental factors don't seem to change for this person. So their situation that they find themselves in, the problem that they find themselves in, doesn't seem to change for them, or it just intensifies and gets worse and worse and worse. And this is how it develops into a more serious problem, into what we would call a major depressive episode. So it is something that is long-standing, but also it doesn't have to be that long. To be diagnosed with depression, you only need to have those symptoms for 2 weeks.
Sure.
So if you have if you have those symptoms for 2 weeks, and the symptoms I'm talking about is this feeling of intense sadness for 2 weeks, ongoing for 2 weeks, feelings of no longer finding pleasure in things that you used to enjoy, having problems with sleeping, insomnia or sleeping too much, things like problems with your appetite, so you're eating too much or you're eating too little, concentration issues, feelings of worthlessness, feeling overly guilty for things that don't really make sense to others, suicidal thoughts, difficulty in decision making, feeling completely fatigued. These are just some of the symptoms of depression, but you only need to have these symptoms for 2 weeks.
Sure.
And the two major symptoms is the sadness and then the loss of pleasure in activities that you used to previously enjoy. So we say that it needs to be there for an extended period of time, but 2 weeks is the minimum. As long as it's been there for 2 weeks, we can diagnose you with depression. So that's how it develops. It can start off as something small, but as the problem intensifies and the person feels as though they can't solve it, I think then it really starts to solidify and become a real problem.
Leandra, I would thought that depression is a build-up over 6 months, over a year.
Yep.
Did you know that it's only depression can within 2 weeks you can come to a point where you want to put your hand to your own life within 2 weeks.
Sure.
Do you have any questions for our young lady Kim there?
Yes, I do. So Kim, I'm very curious about this because obviously, as an outsider and as a layman, you don't really understand the terms and those kinds of things. And also I've heard that there's different types of depression. And also when it comes to, like, for instance, borderline personality disorder, a lot of the times because there's a spectrum, people don't understand it. So they just throw words like, I feel depressed, I'm suffering from depression, I've got anxiety. But in actual fact, there will be an underlying issue that you don't deal with because you don't diagnose it properly. So could you maybe give us an idea of the different types of contributing factors that are linked to depression and anxiety, and then suicide, fear, those kinds of things?
So first and foremost, to be diagnosed with anxiety, with depression, with a personality disorder, actually any mental health issue, it has to affect your functioning. So if it is affecting your functioning at home, at work, in your social spheres with peers or colleagues or so on, and you cannot function properly in those areas, then we can diagnose you, along with the symptoms, diagnose you with some kind of mental illness, right? So everybody will loosely use the words, oh, I've got anxiety, or I've got depression, or and so on and so forth. But if it's not affecting your functioning, so if you're not able to take care of yourself at home, if you're not able to do your job at work, if you're not able to socialize or interact with your peers or colleagues, then we can talk about you having an actual disorder. But if we all have anxiety, we all, the loosely termed, we all get nervous, we all, struggle when we're placed in situations that we're not used to. But the minute it becomes severe enough to affect your functioning, that's when we're talking about disorder. And that's when we say, that's when you can formally diagnose somebody with depression or anxiety and so on and so forth. So when it comes to depression, contributing factors can be things like genetic predisposition. So if there has been depression in the family before, same thing with suicide, with all mental illness, to be fair. If there has been a history of this in the family, there is a predisposition, or it makes them more exposed to presenting with those kind of issues further down the line. Things like environmental factors, which I mentioned before, alcohol abuse, family dysfunction, problems in the communities or relationships. Those things are sort of the environmental factors that can contribute to the development of depression and anxiety, all kinds of disorders. And then the other thing specifically for mood disorders, which is like your depression, anxiety, depression and bipolar, is what we call a biochemical imbalance. So for instance, the neurotransmitters in your brain are not functioning correctly, and therefore there's an imbalance, and that can cause these symptoms as well. So it's an interplay of those three areas that can contribute to the development of depression.
No, that's good. Hi, everybody. We are on the Inside Show here, and we are so glad to have Kim McKay with us here. She's a clinical psychologist, and she's practicing in Pretoria, and we're asking her all the necessary questions. If you have any questions out there, please, do you have already? Thank you so much. But if you have questions out there, please hit that questions at us, and then we will be so glad to ask our clinical psychologist all the necessary questions. And Leandra just noted to me that there is a question already.
There's actually quite a few questions here, Kim. But I'll start with the first one, and this one is from Candace Sammy. And she asks, what are the early signs of depression in a young child that you should look out for? And then also, I think you did allude to this question earlier, but I'll ask it again. If you have a family chain of depression from grandparents right down to uncles and aunts, how do you look out for the signs in the next generation? And that's the question. And then I will go on because there's a lot of questions.
That's
here.
good. I'm happy about that. So,
Yes.
so we've got the right person. Yeah, Kim.
Definitely.
Shoot from the hip. All the best. Thank you, Kim.
No problem. I think my answer will sort of cover both questions. In young children, it's I think more difficult to see the warning signs. But any change in behavior, as a parent, you know your child. So if your child now starts to act differently, it's a warning sign. So if you had this boisterous child, outgoing child, all of a sudden becomes introverted and doesn't want to engage, that's a warning sign. Signs of irritability or, anger outbursts for young children, these are warning signs, and that could possibly be depression. So any change in behavior that you notice, I would say take it seriously and do further investigation. So take your child to the clinic, or if you have access to a psychologist, to the church. There's counselors at the church as well. So I would say then take the first step to go and investigate further as to why this change is happening in your child. If we look at the second question of how do we notice that now in the next generation, the same thing. The biggest warning sign for depression is a change in behavior. So the person becomes different from what you had previously experienced them to be. They might socially withdraw from interactions and no longer want to be part of certain things. Hobbies and things that they used to enjoy before, they no longer have an interest in doing. They are sad all the time or irritable. So sadness and irritability are warning signs for depression as well. If you've noticed problems with their sleeping habits, their eating habits, any changes in their behavior would be warning signs that I would say you should look out for. The people in your lives and you've had experiences of them. So anything that differs from who they normally are, I would say could be a warning sign of depression.
Good morning, Kim. There was one question, and I think you alluded to the fact about the family history regarding depression and so forth. But one aspect that I wanted you just to talk about was, would family history of suicidal behavior, as well as the successful suicide attempts, contribute to why people, especially young people, would take their own lives?
I think so, absolutely, because this is how it works. So when somebody in the family has committed suicide, especially for young people, it is seen as a way to solve a problem. Okay, so it is a tool that you can use to solve your problems. That's essentially what suicide is. People don't know how to solve a particular problem or to get rid of particular feelings. And so the only tool that they have that is readily available to them would be suicide. So especially if you've had, this example being, for lack of a better word, being set from family generations before, it seems like a really effective way to solve your issues. So it definitely can. It's learned behavior. So, they see it being done before, and I mean, it solved the problem for that specific person. And so they see it as the only other way to be able to solve their problems, because a lot of the time these suicidal ideations or thoughts is a very internal thing that they don't usually just express. And so when you're having this internal struggle, there's no new information that can be entered into because you're not talking to anybody about it. And so your reference point is, well, that's where I've seen it. It worked for this specific person. So surely it will help me through whatever I'm going through as well.
Kim, just before Leandra gets to the next question, what's the impact to the remaining family after walking into a room? I recall about maybe 5 years back, Pastor, can you remember an incident, we're not going to mention names, in Reveille? Somebody asked us to come out there. But can you recall that incident? I think the son committed suicide or something like that. Did he hang himself? Yeah. Now, walking in there, see your son hanging from the ceiling, from a tree or something like that. What's the lifelong impact, not just to the parents, but to family members and peers and friends? Can you share a little about that?
I mean, it's devastating, completely devastating to see your loved one in that position. And it's traumatic to the brain. The brain registers that as a trauma. So obviously that would then impact the brain in a negative way. And I've seen it in my practice. People would suffer from post-traumatic stress disorder, where they have flashbacks of seeing this image over and over and over. So it definitely has devastating effects on the family that's left behind. And the interesting thing, though, is that the person who commits suicide gets to that point because they think everybody will be better off without them. So they don't realize the impact of them leaving this world on the rest of the family. So when people make statements like suicide is selfish or it's a very self-centered act, they can't see beyond the problem. Imagine you are in the eye of a storm. All you see is the storm around you. You don't have perspective of the outside and how to deal with the storm. So they only see what is around them and they don't realize the impact that it has on somebody else. And they have rationalized it in such a way that my family and my loved ones will be better off without me. And so they punctuate from that point and whereas the family is at a complete loss. They've lost somebody so dear to them, and it affects them for the rest of their lives. Dealing with loss is something that your life completely changes. But I think it complicates the issue a lot more when you lose someone through suicide, because there's these, feelings of guilt, feelings of shame, feelings of anger, perhaps towards the person for taking their own lives, shame from the community, having, losing, there's stigma attached to losing someone through suicide. So there's a lot of unresolved and complicated emotions that come from losing somebody, particularly.
That's so sad. That's so sad. Leandra, do we have another question from some of our viewers?
Yes, we do. So we've got 2 questions from the same person. So I'm going to ask both of them. They're not the same, but I'm going to ask both of them. So this is from Felicia Peterson. And her first question is medication necessary as a form of treatment for depression? And then the next question is, if an adult seems to be suffering with depression, how do you get them to seek help when they are not susceptible to it or accepting of it?
Sure.
Those are the 2 questions.
Okay, so I'll address the first question with regards to medication. So with depression, it depends on the severity. So if the depression, we have different levels. You can have mild depression, moderate depression, or severe depression. I would say depression that is moderate to severe requires medication, because now we're talking about the 3 contributing factors I spoke about earlier. If there's an imbalance of neurotransmitters in your brain, the only way that we're going to be able to replace that is through medication. So the combination of medication and therapy is the best treatment for depression. If you have mild depression, you can do things like therapy, talk therapy, working through it, working through the issues, and usually it has a very positive effect on that. But when we're dealing with more severe forms of depression, I would say the combination of medication and psychotherapy is the best treatment combination for that. Then in terms of the second question, it's tricky. It's extremely tricky because in order for the person to get help, they will need to want help. All you can do is, I think, encourage. Also, talk about it, point out, I've noticed, this and this about you. I've noticed that you seem sad. Do you want to talk about it? How are you feeling today? What's going through your mind? So engage the person possibly in conversation, and perhaps that way they might realize that, they talking about it helps, and they might then be open to seeking therapy. But I would say don't give up on the person and keep on trying to engage them in conversation around seeking help, seeking treatment. But at the end of the day, there is a level of responsibility that has to come from the person themselves. If they are not willing to receive the help, there's no way that anybody can be able to help them or to assist them or support them in that way. So I would just say be persistent in trying to engage with that person.
Sure.
Yeah. For a preacher, you will look at faith and works. And you mentioned something very interesting, like you take the medicine and therapy.
Yes.
It's like when you come to a therapist, there will be some kind of homework that you have to do for yourself. Because the therapist will sit on the other side, will guide you, try to lead you. But if you also don't do something for yourself, you will not get out of it. Give me some kind of idea. What's the type of things that people should do when they feel depressed? Most probably you mentioned 3 levels of depression. And let's say it's the beginning or the middle stage. It's not a severe depression. What should they do to get themselves lifted out of that form of depression? Kim, I must just mention, when I'm under severe pressure, I realize something. I cry for a stupid movie. I think it's like, there's nothing in this movie. I just cry for this movie. Or
Yes.
It's like, what? Why am I doing this? It's like, but it's like I'm not severely depressed, but something is bothering me, and I'm oversensitive. Give us some of the symptoms and stuff that we can help ourselves in some form. And I just want you just to share a little about that, Kim.
Okay. I'm very big on having you time and kind of checking in with yourself. So I would say for daily practice for anybody, if whether you're depressed or not, is to check in with yourself. A lot of things happen throughout the day that has various levels of impacts on us. And what often happens is we're so busy and we kind of just go through life and we continue and continue. And then you do watch the movie and then all of a sudden you find yourself crying because there's been sort of unresolved emotions or feelings about things that have happened throughout the day or throughout the week that we haven't really gotten a chance to process through. So in terms of checking in, I would say something like, finding a quiet space, sitting, checking in. How am I doing today? How was my day? What affected me? How did I feel about the situation? What can I take from it? What can I do differently next time? So just checking in with yourself, I think, is a beginning of a good practice. Then for people who have a mild depression, I would say get busy. Get busy. So exercise, engage, find something that gives you some sort of purpose again. As far as possible, try to not be too still all the time, because that's when it kind of starts to pull you down and starts to drain your energy. So exercise, engage with peers, every now and then check in with other family members or friends, and then do a process of journaling also works really well, to write down and process the thoughts and emotions that you've been dealing with on a daily basis.
Kim, if we have youngsters watching now today, they're in a class of 30, 40 children, 20, 10 is irrelevant, and they notice behavioral changes. Kids are very private. They don't like the idea that you in their business and stuff like that. How can you advise somebody watching now that's in grade 10, grade 11, grade 12, and they notice change in behavior, and they're also scared to tell the teacher, the principal, they're scared to let the family know? What's the best thing to do to gain the confidence of that person? Or I don't know. Can you help somebody out there that said, you know what, I know of somebody in my class. She changed drastically. She's negative, or he's negative about everything. Always talking about maybe the divorce or the lack of funds in the house or the bullying or stuff like that. What should a kid do in grade 10, 11, and 12 when you notice another child struggling?
Engage with that person. So go up to that person and ask, how are you doing? I've noticed you've changed, or you've become quite sad or withdrawn. Is this a good time to talk? Would you like to talk about this specific thing? How can I help you? How can I assist you? What can I do to support you? And when the person then, if they open up, to thank them, thank you for trusting me enough to open up about this. And encourage them. I think perhaps we should take this to our teacher, and I'll be there with you. I'll stand with you. I'll support you through it, and we can get you the help that you need. So don't ignore the issue. If you see a change in somebody's behavior, approach the person and try to engage in this conversation, because sometimes that person is so closed off and within their problem that they don't think people care, and they don't think that anybody even notices that things are different. So I think already by engaging with them and asking questions and asking how you can support and be there for them will begin to make a difference and give them the confidence that they need to be able to then seek the help that is required. But ask. If you notice something, go to that person and ask. Don't try to argue someone out of their feelings.
I like that.
So,
Share a little more about it.
If they're sad, if they're upset, if there's something that you think is minor, or you can see the solution to the problem, don't minimize what that person is feeling, and don't argue them out of what they're feeling. So don't say things along the lines of, don't feel like that, it's going to be better. Like, man, that's not such a big problem. You're going to be fine. Because that minimizes what they're feeling, and then will make them close off again. Because you're not coming from a place of understanding or a place of curiosity. So rather go to them open-ended and with a whole lot of empathy. Imagine yourself in their shoes and imagine how difficult and scary it must be to be experiencing those kind of emotions. So validate how they're feeling. I can understand that it must be really difficult to be going through this, to be feeling so sad. Would you like to talk about it? Or let's talk about it. Or what do you need me to do for you? Can I just sit with you and support you through this? So try and be as supportive as possible, suspending your own beliefs or ways of trying to solve the problem. You're not there to solve the problem. You're there to support the person through whatever they are dealing with.
Tell me, just before Pastor Neil goes, ask a question. Tell me, Kim, don't you think somehow on at school that somewhere we should start building these things in guidance or guidance classes or something like that? There should be something around that. Do you maybe know if there's anything at our schools in line with it? Because if you pick it up at an early stage, and I know everybody is on this. You can't call a child a he or a she. There's a name now for that. Leave the child till the child reaches a specific age to make it their own mind up. But nobody cares about 23 suicides per day. After every 40 seconds, worldwide people are dying. They put the emphasis on really stuff that's so irrelevant. People are dying. What do they do at school? Do you know anything about that?
Look, again, our country has such a disparity in terms of what's available to certain communities. So there are schools who have programs like this in place, where there are psychologists based at the school, and they have classes and psychoeducation about depression and how to deal with it. But if we really are honest and we look at the state of our country and just the lack of resources, I think, in different communities, not all communities have access to this kind of psychoeducation and this kind of support. So I do think that it is something that we, I think government as a whole needs to put a lot more emphasis on, and especially in schools, and in disadvantaged communities especially. That's where I think we need it most, because communities elsewhere have access to these, but not everybody has access to this kind of support and education.
Kim, this is exactly where last night on our briefing, I asked you to help us on a monthly basis from a clinical psychology perspective, and you avail yourself in this arena, which I'm so thankful for. And so every month we'll have you on, but we need you to take us by the hand and help our church and so many other churches. If we can start a model somewhere here about we don't want to do your job. We're not psychologists. There's no way that we can even come close to that. But we should have a point of discussion, dialogue. We will open a line. We have a family pastor in our church. We'll open a line for kids to phone, or anybody to phone for that matter. But we really don't know where to start. So most probably offset somehow. We should meet and have coffee with myself and our team here, and we should strategize exactly around how can we help our communities out there, specifically on that one point that our church, our schools are so underprivileged, and our communities are so underprivileged. So the church should start something like that, and we should have classes
Yes.
On something like that. Kids should feel free to come to us, phone us, there must be a room where they can express themselves or anything else. Maybe on a very light note, somebody in somewhere, I don't know where it was or where it is, have a line which they call a scream line. I don't know if that will help, but they've got a scream line. You dial that number and you just scream on that line.
Wow.
Yeah, I must just say, I feel many times like I want to dial a number. I just scream.
Okay.
But you know the best.
So what's that number? Let me just write
Everybody
it down
wants
quickly.
it. So you just want to scream. But you know what? I feel so sorry for people that's phoning me for debt, or people phoning me for selling us, doing a sales speech, or somebody's phoning me because that's my time to say, do you know I am a busy person? And I just lash out on them. It's like, yes, phone me again. You will get a better half of me.
Yes.
I'm joking. It's not supposed. Personally, you've got a question for Kim.
Kim, one of the things that we battle with, I think, on a global level, is when there's an attempted suicide. One can only imagine the awkwardness in the house regarding the situation. So how would you advise parents, siblings, cousins, and so forth to deal with this attempted suicide?
I think the best way, and I mentioned it earlier, is to come from a place of empathy.
Yes.
If somebody has gotten to the point where they have attempted to take their life, can you imagine the place that they had to be in to be able to decide to take that choice or to attempt to take their lives? So afterwards, they are also experiencing possibly feelings of guilt, feelings of anger, maybe, I really wanted to die and now I was not successful. So there could be a lot of mixed emotions that the specific person is going through. So from parents, I would say, from a parental point of view, I would say deal with your child or the person with empathy. And engage them in conversation. How are you feeling today? How are you feeling about the fact that you're still here? That your plan didn't work out. Don't ignore the situation, because I think a lot of us try to just avoid it and walk on eggshells and try and sort of maintain as calm as possible in the household. Talk about it. It's uncomfortable. Absolutely. It's an extremely uncomfortable conversation to have. But the moment we avoid it, it again sends the message that it's not important and that it's an issue that we don't talk about. And suicide it's not a secret. It's something that we need to talk about. It's something that we need to engage with. The only way that you're going to be able to understand where that person is at is by talking to them about it and engaging with them in around their feelings and emotions around what actually happened.
Kim, we are mindful that you have a 10 o'clock session and we want to get you off the hook there. Leandra, do you have one more question for Kim?
You know what, Kim, there's actually so much comments and questions. And once again, it just highlights the fact that this is a very important conversation to have. And I just want to say, especially among people of color, because there's a stigma around mental health and mental illness. It's just like you mentioned earlier, it's a matter of you brush it off and there's no empathy and, get over yourself kind of a thing. You will get through this. That's the thing. But not knowing that, this person is in a deep, dark hole, like a lot of people explain it to be. And I just want to read some of the comments. So Jennifer Logan says that her teenage daughter is listening to this today. She stopped her studies so that she could listen to this. And she just wants to say thank you so much for the information. It's really what all parents need to hear. And then we just want to say thank you so much to Veronique Goliath, who shared her story with us. She says when her dad passed away, she laid in his cold arms for a few minutes. And that is where her depression started. And it was the most difficult time for her. And it opened up a lot more than she thought it would. So she just says thank you so much for this, because what you're saying is so true. And once again, we can see the deep hurt and the agony that people are facing with. And it's a topic that we need to have more dialogue around. Then Victoria Twala asks, can someone die from a broken heart? Juanita says, can medication become an addiction? Can it affect one negatively? Felicia Peterson says, thank you, with an exclamation mark. And then Candace Sammy asks, what outlet is there for a person dealing with the person that has depression? Because she says she thinks that it's draining and hard work to also allow yourself not to become depressed because of other people. And then Victoria also asks, what do you do, or how do you go about to stop someone from contemplating suicide?
We've got Kim McKay on the line, but the time has passed. She needs to run. She's got a 10 o'clock counseling, session with one of her patients. And Kim, just in closing remarks from your side, I know there's a lot. You realize now your contribution towards the community is just so huge, and we need to have you more and more. So we'd love to have you every month on. So next month we'd love to have you on again, and so on, and schedule you so that we can just get all these things out of the way. Closing remarks from your side, Kim, and then your goodbyes, and then I will let you go.
All right. What I will do is if you can send me those questions, I'll record a little snippet where I answer each and every one, and then that's something that you guys can post on the show as well. Just in closing, I want to end off by saying that depression and suicide is a real thing. We've seen it, and we see the impact of that in our communities. It's not a selfish act. The person has to be in a really, really deep, dark place and not have the tools to be able to solve their problems. And these constant thoughts that suicide is the only way to deal with their problem. So I think if we begin to see suicide in that way, it will enable us to have a lot more empathy for people that are struggling and dealing with depression and specifically thoughts around suicide. I'm really looking forward to engaging with you more on topics such as this and others. And I look forward to this relationship going forward.
Great.
So thank you so much for having me.
Thank you.
And I wish you well, and I hope you all have a wonderful day going forward.
Thank you.
From our side in the Inside Show, that is the honorable, most lovely clinical psychologist, Kim McKay. Thank you so much for your time and your effort. We would love to let you know that we appreciate your time and effort, and we really appreciate and love you. May God bless you. Have a super wonderful day, Kim, and thank you for coming online. Take care. You are more than welcome to run. Take care. Bless you, man.
Bye.
Thank you. Hi, everybody. Thank you so much again. And we would love you, please. There's a number we will release a number online.
Yes.
The number of our offices are 011 494 1363. 011 494 1363. We at least, let's start with dialogue. If somebody out there, you are deeply depressed and you are suicidal and you feel like you want to just end your life, please give us a call. We would love to receive your call. We'd love to connect you with somebody that can walk with you, at least have an ear. And in the studio, we have our family pastor with us. He will be able just to hear you out and hear where you are. We're not going to be unreasonable. We know a little more about being depressed and the level of depression. So we will pray with you. We will guide you. We will let you talk. We'll let you scream if needed, whatever is needed. But please, as long as you don't put your hand to your own life, it's not worth it. We love you. You are valuable. We care about you. And we know you will make an impact in this world. And for those who didn't do well in matric, I tell you, it's not the end of the world. Go do that 1-2 subjects over. I know of a lot of people who've got honors and masters and doctors that's in high places, businessmen, businesswomen. They failed matric once, they passed it the second time. You can do it. Just don't give up on life. Stay focused, stay committed. And if you can get to the nearest church for wherever you are and go speak to the pastors at the church, just attend somewhere, watch online good preaching. The gospel will help you. It will just lift you and change your circumstances in your life. Final remarks from both of you, and then we'll greet everybody. Pastor Neil.
Okay. So I just want to echo what Dr. Kali is saying, that you are loved. I want you to know that there's nothing more important than you. I want to say that you are going to become the one person that you wish you had in your life. Someone to hear, someone to listen, and someone that has gone and walked this road and defeated their problems as well as suicide. I want to say you are special, and we love you dearly, and call us. We're here for you. That's why we are called. And I know that you are going to make a success of your life, and that you will amount to what you have desired that you want to be. May God bless you.
Thank you so much. You know, we don't have a 27 open line, but we either offers from 8 to 4, and just to start off at least somewhere, and then we're going to work and do our utmost best to have a 24/7 line available for somebody to phone us 3 o'clock in the morning, 2 o'clock in the morning, 1 o'clock in the morning. It doesn't matter, as long as you don't put your hand to your own life. Closing remarks from your side, and we're out of the show.
So I just want to say thank you to everybody who was involved in the show, and for everybody who was watching, for those who shared their personal stories with us. And if you know of anybody, if you yourself are suffering from depression, and maybe you have not been diagnosed with it, but you have seen the signs and you know that this is something that I'm struggling with, or you know somebody who's struggling with it, please do reach out. We cannot emphasize it enough.
Yeah.
We want you to live. We want you to, as God says in Jeremiah 29:11, my plans are to prosper you and not harm. It's for a hope and a future. And I believe with you that, you know what, you can get through this. For everybody else not washing, please show empathy towards people. You know, you might not have been in that person's situation, but try to place yourself in that frame of mind. Be kind to one another. And thank you so much, everybody, for those who commented, those who asked questions. Like Kim said, she will answer those questions that remain that we couldn't get to in a little snippet that we will post on our Instagram page and on our Facebook pages. Thank you so much.
Thank you so much to everybody. Well, from my side, it's time to say goodbye. Please subscribe and hit that bell, because every single time when we come online, you will know. Well, from my side, all the best. You must have a super Tuesday. I love you. God loves you best. You take care. Goodbye. Good morning, everybody. It is so good to have you here with me.
Imagine if you have your vision as the car with the right team.
Imagine how quick that vision will come into the picture. Something that was taking 5 years takes 3 months. This morning is all about the leadership and influence.